All right, ready to dive in. Today's topic might surprise you. We're going to be talking about dementia and oral health.
And it's a connection a lot of people don't know about, even if they know a lot about dementia care.
And that's what we do on the deep dive. Take a close look at some research and see what we can find. We've got a fascinating article to help us understand this unusual connection.
And it all starts by understanding dementia itself.
Okay, so let's do that. What exactly is dementia?
Well, a lot of people think it's just memory loss. And while memory is a part of it, dementia is really about way more than that.
Yeah, we've all had those moments where we forget where we put our keys.
Right, exactly. And that's normal.
Yeah.
But dementia, it's different. It actually affects all kinds of cognitive abilities, not just memory. Like imagine struggling to follow a conversation
Or
or
make decisions.
yes, exactly. Or even just recognizing familiar faces. Those are some of the things people with dementia have to deal with every day.
Wow, that really changes how I think about it. It's more than just forgetting things. It's forgetting how to do the things you've done your whole life.
And the article really drives that point home, using this phrase, impacting the very essence of who we are, which I thought was really powerful.
It is powerful because how do you even tell the difference then between what's a normal memory lapse and what could be something more serious like dementia?
You know, that's such a good question, and it's one a lot of people ask. The article gives a really great example. Like, it's one thing to forget where you parked your car. We've all been there. But it's totally different to forget what a car is or how to
Yeah.
drive it. It's like forgetting how to do things you've done thousands of times.
And that's dementia. It changes the way your brain works, how it functions.
Exactly. And that's why recognizing the signs is so important. If you know what to look for, then you can get help, get support early on. And that actually leads us to the heart of what we're talking about today, oral health.
Okay, because I don't think of those two things together, dementia and oral health.
You'd be surprised. The article does a really great job of explaining it all. But essentially, all those challenges we just talked about, the communication problems, the changes in someone's thinking, those can directly impact a person's ability to keep up with, their oral hygiene.
Oh, okay. I see where we're going with this now. So how does that work? Dementia making it hard to keep up with your oral hygiene?
Well, imagine you're trying to help someone brush their teeth, but they can't really understand what you want them to do.
They
Or,
have a toothache.
yes, a toothache, but they can't tell you what's wrong or where it hurts.
Oh, yeah. I can see how dementia would make that really difficult.
And the article really stresses how important that is, because if someone with dementia isn't able to keep up with their oral hygiene,
It can lead to bigger problems.
absolutely, tooth decay, gum disease, even infections. And those can cause even more problems beyond just, your mouth.
So it all really is connected. That's something I just never thought about before. But there are things you can do to, like, prevent that from happening in the first place, right?
Yeah, definitely. And that's the best part. The article doesn't just talk about the problems, it gives you solutions.
Mm-hmm.
And it all starts with, good oral hygiene, brushing, flossing, all that good
Oh, the
stuff.
basics.
Exactly. And that seems simple, but you'd be surprised how many people don't realize how important that is, especially for someone with dementia.
Because if you take care of your teeth, you're less likely to need serious dental work later on.
Right. And for people with dementia, you really want to avoid those invasive procedures. If you can, they can be really scary and confusing for someone who's already struggling, which is why taking care of your teeth is extra important.
Okay, that makes a lot of sense. But what about the caregivers? Because they're dealing with so much already, how can they help with all of this too?
Oh, the article talks a lot about that too. And they have some great advice. One thing they recommend is setting reminders, and not just for the person with dementia, but for the caregiver too.
Oh, interesting.
Yeah, it's like you make it a routine, something you do together every day.
Oh, I like that.
And if the caregiver isn't sure how to help, like if they aren't sure the best way to brush someone's teeth or floss, the article says talk to your dentist.
Oh, good idea. Get a demonstration.
Exactly.
And it's good to be reminded that asking for help is okay.
It really is. And, the article also talks about how it's good to try different things. Like maybe someone with dementia has trouble holding a regular toothbrush, so you get them one with a bigger handle,
Oh, that makes sense.
or an electric toothbrush. Anything that makes it easier for them to brush their teeth is a good thing.
So it's about adapting, just like we were talking about with those early warning signs for dementia.
That's a really good point. It's all connected. But we've mainly been talking about what to do when someone first starts showing signs of dementia. But what about when it gets more advanced? What happens then?
Yeah, caregiving changes as dementia progresses.
It does. It really does. As dementia progresses, you're right, the caregiver's role changes too. They have to take a more active role.
And that includes oral hygiene.
Yes. And the article actually gives a lot of advice for that too. What to do in those later stages when the person needs more help.
That's what I'm curious about because we've talked about early signs and prevention.
Right, and it can feel like a whole different thing when you get to those later stages, but the article really makes it clear that even little things can make a difference.
Like what kind of things can caregivers do?
Well, for example, just helping to brush their teeth after every meal.
Okay, so still brushing as much as possible, even if it's more difficult.
Exactly. Even if it's just a quick brush, it's better than nothing. Or having them rinse their mouth with water throughout the day.
Oh, yeah, that's a good idea.
Simple things, right? They even talk about, like, wiping the mouth with a damp cloth, especially after they've had something sugary.
So it's about adapting, just like we were talking about before.
It really is. You have to adapt to what they can do and what they need.
Mm.
And sometimes it's even about, thinking a little differently. Like the article mentions saliva production medication.
For dry mouth.
Exactly.
Yeah.
Dry mouth is a common problem. And especially for people with dementia, they might not even realize they're thirsty.
Oh, wow, I never would have thought of that.
Yeah, it's something to look out for.
It really shows how everything's connected. We don't always think of oral health as this important part of overall health.
And, speaking of connections, another thing the article talks about is how important it is to find a good dentist, a dentist who understands dementia.
Because not every dentist has experience with that.
Right. And it can make a huge difference having a dentist who knows how to work with someone who has dementia. It can make it so much less stressful for everyone.
That's so important, that human connection.
It really is.
Uh-huh.
Don't be afraid to ask questions. Ask the dentist about their experience with dementia. The more you know, the better you can advocate for the person you're caring for.
It's like you said before, knowledge is power. So is there anything else caregivers should keep in mind when they're talking to the dentist?
Oh, for sure. The article stresses how important communication is. Let the dentist know what the person's routine is at home, what helps them, and what doesn't. And if you notice they're showing signs of a toothache,
Like if they're making a face when they chew or something.
yes,
Yeah.
exactly. Let the dentist know because they might not be able to communicate it themselves.
It's like you're being their voice.
That's a great way to put it. You're their advocate.
Well, this has been a fascinating deep dive. I feel like we've learned so much.
Me too. If you're listening, I hope you got a lot out of it.
We covered a lot. We talked about what dementia is and what it isn't, and we talked about the connection between dementia and oral health and what caregivers can do.
And the biggest takeaway for me is that it's all connected and that even small things can make a big difference in someone's life.
Well said. And if this deep dive sparked your curiosity, check out our show notes. We'll have links to all the resources we talked about, including that amazing article.
And be sure to join us next time for another deep dive.
Until then, keep asking questions and we'll keep exploring.